We are back with Dr. Rachel Rubel, and we are discussing the importance of protecting your eyes this summer, and she's taking your questions. All right, this question is, can my eyesight contribute to my migraines?
Possibly. When we talk with migraine and headache patients, we really want to do a full comprehensive health exam where we're looking at the front of the eyes, making sure they're not dry. We're looking at the back of the eyes, the retina, making sure there's no swelling of the blood vessels or any fluid around the optic nerve that could contribute to headaches or migraines. And we also want to check to see if they have a prescription that maybe they're not corrected for that is causing that strain leading to migraines.
Okay. This person's asking about red light therapy. Is it helpful or harmful to eyes? And I'm guessing they're using it like for the wrinkles, like maybe around their eyes.
Yeah, we're seeing a lot of studies being completed investigating the use of that low-level light therapy. And we experience with patients that they do see an improvement. What it's doing is it's working on your meibomian glands, which are your oil glands along your upper and lower eyelids. There's about 28 to 30 oil glands. And what they do is they're helping to essentially make them more wet so they function better and you have less dryness to the eyes.
Okay. All right. This person is saying, I've been to the eye doctor for severe redness and watery eyes. It's still there after several months, and I'm 60 years old. What should I do?
Definitely, we always look at the underlying condition. We want to see what could be contributing that. Has there been lab testing or hormone testing? What's the environmental factors look like? What is the medications the patient's on? There's so many factors that can contribute to red eyes, dry eyes, that it's really looking at the big picture to see what is causing that, and then being able to solve it from there.
Okay, so don't leave it with whatever the doctor gave you. Go back to the doctor and have another discussion.
Exactly. That's what I'd recommend because one drop that may work for one patient, that treatment may not work for another patient. Every patient is different.
Okay, this person says, I get a headache after a while when I wear my sunglasses. Is there anything I can do to prevent the headache? Maybe my sunglasses are too dark or something.
So a couple things you want to look at there is one, you want to make sure the sunglasses aren't too tight, especially if around the ears, pushing behind the back of the ears there. The other thing you want to check the lenses. Are they UV protection? Are they polarized? To know if they're polarized, you can hold them up to a screen, a computer screen, hold them horizontal, turn them 90 degrees vertical, and see if the lens changes jet black. If it changes jet black, they are polarized. I have seen patients that wear polarized sunglasses that may not work well for them and cause headaches. I love polarized lenses because they really cut down the glare, especially if you're out on the water, driving down the road. But those glasses aren't for everyone. So may want to look at that as well.
This next question is, if you have macular degeneration and you have cataracts, should you go ahead and get the cataract surgery?
It depends. It depends on what is the vision, what is the density of the cataracts. We all grade, there's different types of cataracts and they're graded at different levels. So I always like patients to have cataracts that are ripe enough to remove where it will impact the vision, where patients will have better vision after cataract surgery. If the cataracts are very small, it may not be as impactful to have done.
Okay. We've had several questions about, does it help to have prescription driving glasses tinted since you can't wear your prescription glasses with sunglasses, right? You don't want to wear two sets of glasses, do you?
So you don't want to wear two sets of glasses. Couple of options there. You could wear regular glasses that have transitions that change color. They do make transitions that change color in the car. They actually get very dark in the car. So that's an option. And then when you go inside, they change back to the clear color. Another option is having the prescription sunglasses. Again, you cannot go wrong with that. Patients typically love having that extra protection when they're driving or outside on the beach or the lake. So good options, just always want to make sure we're protecting the eyes.
This person's asking, what are red or rose colored lenses good for in eye care, if anything at all?
They can be really good actually, especially low light conditions. Rose can help with reduce light sensitivity and block out certain wavelengths of light, providing better clarity and contrast.
All right, so someone's asking, is there a difference? I mean, they know that there's a difference between transition lenses versus sunglasses. If you had to pick, would you pick one or the other?
I always tell patients, pick one of them. If you find yourself not going to reach for your sunglasses to put those on when you go drive or go outside, then stick with your glasses that have transitions in them. Then you're protected. But if you're going, no, 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 I'm going to switch, then sunglasses I do like better because they tend to be a little bigger, have a little more coverage around the brow and the side. Because remember, sunlight can come in from all angles, causing those cataracts and harmful UV rays that lead to multiple conditions in the eyes.
What about those sunglasses that are like the mirrored sunglasses?
Yes, I love mirrored sunglasses. Mirrored sunglasses, though, do not mean they're protecting your eyes. You want to make sure they're UV protected sunglasses. And the mirror is a coating on the front. It blocks out people from seeing your eyes. It's a cosmetic effect. And so you put those on and people cannot see what your eyes are doing.
Okay, and sometimes you want that. All right, we've got one last segment before we say goodbye for tonight, so make sure you get your question in 336-379-5775. Let's check in on the forecast.